So my name is Njoki, Dr. Njoki. I'm from Nairobi, Kenya. Married with 4 children. I'm a medical doctor by profession. I'm an obstetrician gynecologist. And recently I've been doing a lot of healthcare management in the insurance sector. And so I've in the recent past encountered patients who've really had issues with chronic illnesses. They've had to travel a lot abroad. I've been working a lot with foreign travel for patients, especially from Kenya to other countries.
So, Doctor, what is your purpose of your visit in Poland?
This visit is a follow-up to a visit that was done by a Polish delegation to Kenya last month, it was. And I met very interesting people from Poland who wanted to enhance collaboration between Kenya and Poland, and especially in the area of medical technology and medical tourism. And we know that there are very many patients who seek treatment outside the country for whatever reason.
Okay, as you know, approximately 10,000 Kenyans travel abroad annually to seek specialized treatment. This translates to about 10 billion shillings, and KCM is offering one of the solutions around which the team is going to tell us more. Maybe tell us, who is KCM?
KCM Clinic, we are a private hospital specializing in minimal invasive surgeries. Can you tell us more?
Yes, well, generally speaking, we solve the problems. So every time we hear voices from different countries, like for instance Kenya at the moment, we come over and solve them.
And also had already patients from Kenya coming with big problems which cannot be treated here. So this is where we want to give them a solution.
So what is your target, or what do you want to achieve in Kenya?
What we do for now is treating patients in Kenya that cannot get the treatment done in your country. So there are hospitals in your city, here in Nairobi and in Kenya, but unfortunately they don't provide the medicine which is available now on the worldwide market. We are speaking here about very specialized spine surgery, orthopedic surgery, bariatric surgery.
So I'm here in Poland to investigate and see whether this is a viable country for us to do medical exchange, medical tourism, collaboration with the doctors, and to make sure that the patient can receive the best of care from Kenya to Poland. And I'm sure I'll figure it out and see whether it's worthwhile sending our patients to Poland for treatment or collaborating with the Polish people to give Kenyans better health care.
So, Doctor, you've seen the surgery already?
Yeah.
And are operating one of our operating theatres. Mm-hmm. What do you think so far?
Very okay. I think the surgeon has found a technique to simplify what is considered a very complicated procedure. And usually for that procedure, one of the biggest things is the complications. But his technique has made it very simple. I was very impressed. And very quick. I mean, we were done like, when we came in, they had just started. And very quickly, he seems to have mastered the art of doing it. And so I'm quite impressed. I'm very impressed, yeah.
The NHIF has some special budget dedicated to patients that actually seek medical treatment abroad, or that are in the need of getting a second opinion abroad. Is that how it works?
The president and his government in his second term of election has come up with an agenda that has got big, what they're calling the big 4 priorities for his government, and one of them is health. And their target is to have universal health coverage for all Kenyans. And the vehicle that has been given that mandate to provide universal health care is NHIF. It's a very long waiting list, and so of course if a patient needs to have surgery sooner, then they prefer to have it abroad because it's faster. Of course, there's some kind of specialized treatment like bone marrow transplants or some level of oncological treatment that is not available in the country. Some medication is not available. And also the perception, of course, that when you travel out of the country, the treatment is faster, is more efficient, and it's probably even cheaper, and the level of expertise is higher. The ambience leads to, I think, better treatment for the patients. And I have found that in this place. It's very calm, very peaceful, it's not noisy, it's quiet, and I believe it's a very ambient environment for healing. Poland is a new gem that we've discovered that has got excellent medical care, and we can bring our patients here. It's also quite affordable and very high standards of care. So it's exciting to be in Poland.